Hi, my name is Dr. Jacobs. I'm a doctor of physical therapy, advanced clinical nutritionist, and inventor of ASTR. After my second cancer treatment, I used to suffer from chronic pain, migraine, headache, fatigue before I invented ASTR's specialty. Take charge of your health today by signing up for one of ASTR's free online treatment programs. Just click the link on the screen. To become a patient or to purchase ASTR tools, click the link on the screen. If you would like to become a certified ASTR provider, click the link on the screen. All right, Gloria, so give me a little bit information about your background, what you used to do for a living, what condition you had before we had the nutrition function medicine treatment.
Oh, well, actually, doctor, I've been retired for the last 7, 8 years now.
Okay.
I retired early to travel. And
What you used to do before that?
I used to be a nurse at the University of Illinois.
Okay.
And, well, I'm a walker. I walk quite a bit, at least 3 miles a day to 5 miles a day. And I do my exercise. I was so fit. And one day I fell. And so it started 2016, and it started
We are in 2020.
2020. So
Yep.
it's almost 4 years.
4
now.
years now.
And the suffering is there now. Nobody can help me in spite of all the surgeries that I have, which is like 3 times now.
What kind of surgery, briefly?
Well, partial knee replacement. Then the following year, another total knee replacement. Then with the arthroscopic plus manipulation.
After the total knee? Okay.
Yes, after the total knee and another manipulation.
Oh, wow.
So from there, I decided to stop because everything is not working. I've been in physical therapy almost every day. They were, well, if you call it torture, then it is a torture.
I'm sorry.
But what do? I mean, you're talking to a professional, and they said this is the way to do it. So who I am? I mean, I have physical therapy. I went
But
with,
you're a nurse. You
Yes.
just have a medical background.
yeah, I have a medical background, but I don't know the specialty that they have. So I subjected all myself to all this physical therapy and the trauma and all that. But then after that, I said, no way that I'm gonna continue this because what am I doing? I'm helping other people. I cannot help myself. And with this diabetes and the rest of it.
So can you give me more information about your blood sugar? When did it start? How much it was? And
Well, I tell you, the blood sugar, of course, went up.
yeah, the reading was like 500.
Yes, it was 500, plus the fact I was already depressed. I don't know what to do with myself. Then I started logging off and not doing anything, looking up the 4 walls in my house, in my condo, and I said, then I secluded myself for a while until for some reason I could not sleep because I couldn't sleep with the pain in my knee. I happened to see your video and I'm like, oh my God, this is God's send. No matter what, I'm going to talk to this office, I'm going to call. So finally...
You are from Chicago, yeah?
Yes, I'm all the way from
Welcome
Chicago.
to California. Yeah, I hope you
Thank
enjoy
you.
the sunshine here.
Well, sunshine is here, and
yeah.
the person that I need to, a professional that would help me is right here. And I'll tell you, there is nothing more that I can say that you guys, if you have the same kind of pain or anything about pain, come to Dr. Jacobs' clinic. The ASTR is the best that ever happens to me. And I can honestly say to the world that conventional is good in terms of learning things, but learning a different way of doing things is something that you have to put your mind out and be open-minded with the new things and the innovation of Dr. Jacobs. And I do appreciate you, Doctor.
Yeah,
I
thank
really
you
do.
so much.
I really
thank
do.
you so much for your encouragement. Thank you.
I feel that with this event in my life, there's no way that I will forget you.
Yeah, well, I will not forget you too. You're a great patient and you're doing very well.
Thank you.
Very compliant. I'm proud of you
Thank
because,
you.
you know, giving recommendations, supplements, or diet, or working
Yes.
on patient. If the patient is not compliant doing their homework, really, it's not gonna work. Patient has to do their homework to really take a charge of their life, making the right decision, doing the exercises, work on their scar tissue or fascia restriction, or so on and so forth. And I'm so proud of you that you really, like, it was like a night and day.
Yes.
The first day when I saw you, like, you were coming here with a cane.
Of course,
You
I
know,
was like,
you just,
I can't get out of the car.
Mhm.
I was like, you know, I was in a wheelchair. I'm like, I feel so bad. I'm not so old yet, and then I'm using a cane.
How long did you walk today?
Oh my God, quite a bit, Doc.
Yeah, it was like 10 minutes just going back and forth and just having fun, so it was a good time.
Wow.
So before I did the nutrition evaluation and the nutrition treatment and functional medicine, your blood pressure, your blood sugar level was 500.
It's rest, right?
Okay. What kind of medication you were taking, and with those medication, how much it was?
Well, I used to take a lot of basic LAR for the night, you know, like Alantas.
Mm-hmm.
That's
You
like,
taking insulin?
yeah, I'm taking the insulin, which is like 15 milligrams at
So
night.
she was on insulin, okay.
And then I was maxed with metformin at 2,000 a day and a Genobia plus a glyphosate.
So it was 500 fasting blood sugar, okay?
Yes, yes.
So now we literally did for the nutrition is like a week. And
Right.
when I did some testing and you ran another blood work, there was deficiency in several vitamins and minerals.
Yes.
For that week, can you give me update what your fasting blood sugar and what your dosage of medication now?
Well, the blood sugar now is leveled off between, well, I'm running like from 89 to 130.
That's a huge difference from 500.
Yes.
Mm-hmm.
And well, I take down my basic blood from 15 to 12.
Mm-hmm.
And I'm hoping that I could take down my Genumet, which is equivalent of 2,000 dosage of metformin and 100 of Genobia when, you know, when things get better. And now
Because you're a nurse, you know how to do this.
Oh, yes,
Yeah,
yes.
we give you some guidelines with
yes,
that too.
yeah, yeah. I get the guidelines, and you know, then if I could do a little bit more of walking and more of exercise and
Burning
get a
more
little sunshine,
calories,
yes.
you will have better control.
yes.
Yeah. Mm-hmm.
And you know, I'm pretty much happy with what is happening right now. I mean, it's like
What
a
about your
miracle.
energy level? So we know your blood sugar hasn't
Oh.
improved. Like, because when you have your blood sugar is off like this and you're not walking around, there's other symptoms, there's other things going on at the same time. Can you explain it to me?
Well, I only slept like 2 to 3 hours a night.
Before,
Before.
like a week ago,
Yeah,
it was
before
it was
that.
how many hours? 3?
Now,
Mhm.
now I'm going from 5 to 7 hours now.
Okay, in a week. Okay.
And you know, I feel more energized.
Okay.
I feel like something is really moving forward.
Mm-hmm.
And
What about your anxiety or depression?
well, the anxiety right away is gone because I already have
Usually
hope.
patients feel that as soon as they see me. It's not the first patient. I'm just joking.
No, but the hope is there now. You know,
Yeah.
there's a big change, and when there's a big change, everything changes.
Mm-hmm.
You know, you
Mind
can't,
over body.
yeah, you can't deny that. I mean, I understand that because I have worked in a behavioral unit too. Being a nurse, I went in different aspects of nursing, not just neurosurgery and transplant, but I did a behavioral.
So you have a good experience.
Yeah.
Mhm.
So it's a total change. It's like 360 degrees. Now I feel like I have more hope and I have more life ahead of me instead of just worrying about the knee.
Do you feel now after the nutrition guidelines and finding those deficiency that we try to work on building it up, how do you feel? Do you feel you have a better control of your blood sugar? Do you feel like you really can do this to really get over this challenge?
Oh, yes. I mean, before, I don't know how I'm going to do it. But with the guidelines that you have, and I'm being here and seeing you in person, that makes a big difference.
Mhm.
That really is a big difference. I mean, to me, um, having to see the practitioner right in front of you
Mhm.
and giving you enough time to talk to him and tell him your concern and everything that you felt about your body,
Mhm.
that's something awesome that could ever happen to anybody. I've
Mhm.
never had anybody who would sit with me for an hour or more than that.
You're
you
a
know?
nice person. We like to spend time with you.
Thank you, doctor. As I said, I really do appreciate everything.
Yeah, thank you. So, what do you think like about your nutrition now since we worked on it? And you saw doctors before for your blood sugar, for, other like cholesterol imbalance. What you're feeling now about what you had
Well,
so far?
I really pay attention to all those food that you gave in your guidelines about how it affects the area where it gets inflamed. So the anti-inflammatory effect of that, I'm more open to it now, and I'm reminding myself of what to put in my
Did any
body.
doctor go over this with you before?
Never.
Okay, so the blood work that I requested, is that the first time you had those type of blood work and was surprising for you to see a lot of numbers of?
Yeah,
Mm-hmm.
some my doctors had ordered, but not everything, and I was surprised that you have added quite a bit more, knowing what I went through,
Mm-hmm.
and you really process everything according to what you see about me and what my lab results is, and with that, it's really a treatment of the whole body.
Your whole body. Mm-hmm.
And that makes a big difference when someone that you work with really understand the whole of you.
Mm-hmm.
It you cannot exchange that with anything. And before, I used to think that um, I don't really think about health too much because I was strong
Mm-hmm.
and I was doing a lot of things. But when things happen to me like
When
this,
you have some issue, you start to have a
yes,
different perspective. Yeah.
and it's hard to find someone
Mhm.
that will do that kind of treatment.
Well, I actually offer classes for healthcare providers, for doctors, for physical therapists, for chiropractor, that to implement functional medicine and nutrition in their practice. Because reality, a lot of the patient, even you coming for total knee or hip pain or back pain, if the patient has nutrition deficiency or high blood pressure, diabetic, or any other issue, that is not like labeled a disease. It's labeled as a person actually their healing cycle is extremely slow, and we need to figure out why this cycle is slow. Your knee was not healing, but your blood sugar was high. There was other deficiency. You need to control your blood sugar. You need to have enough zinc, magnesium, D, C. We need to figure out what is the deficiency that your knee needs to decrease the swelling. If we don't figure out this, even if I worked on her knee for 100 years, that's not gonna work. That's not gonna replace her zinc deficiency or D deficiency. That's not gonna help her to manage her blood sugar. So that's why we have to really treat the person instead of treating, okay, I'm leaving you
Just
knee.
one part.
Yeah, one part. That's our body does not work this way. You cannot cut that body part and say it's working by itself.
No.
It's the whole system working together.
There we go. That's the
Yeah.
concept of everything that you do that.
Yeah.
And having the chance to come here and discover you in YouTube
Mm-hmm.
is the best that ever happens to me.
Yeah.
Yeah. So again, I can't thank you enough.
Yeah. Thank you so much. I really appreciate it. Thank you for sharing your story. Thank you.
Thank you.
Take charge of your health today by signing up for one of ASTR's free online treatment programs. Just click the link on the screen. To become a patient or to purchase ASTR tools, click the link on the screen. If you would like to become a certified ASTR provider, click the link on the screen.